we all have a story, right? You all kind of have experienced sexuality and gender in different ways. And sometimes those ways are, normal or different. And sometimes the people that you go to for help end up being, and in the music video you see a part where the youth is on the bed and there's like this big scary monster coming out. And sometimes for people who feel different, and I use that word because I've heard it a couple times today, going to get help from county departments is that big scary monster coming out. That's how it feels. You don't know how you're going to be accepted, how you're going to be affirmed, who you're going to be referred to, what they're going to call you, what pronouns they're going to use. And yet, we all explore that, and for some people, it's amplified when you get to have to deal with child welfare services. When child welfare services refers you to health services, and health services refers you to mental health. And so we thought this was a great opportunity with the work that we've been doing over the last few years to say, hey, we've been doing some work and we want to be transparent with you all. And there's some great things happening, but we know that there's still some work to do. So that's why we're here today. We thank you for making the time. And just so you all know, I am not Neil Patrick Harris. I know. It's a thing. I know some of y'all are like, I knew it. You're not going to be able to unsee it. I promise y'all. Yeah, see? I see it over here. Neil. Some of you know them as Doogie Howser. Someone's like, who's Neil Patrick Harris? Doogie Howser. Okay. And also cookies and coffee right after this. So don't go anywhere, y'all. Okay, cookies and coffee. My name's Jamie Estrada. My pronouns are he, his, him. I've been a county employee. I don't know if that makes me good or not. No one booed, so that's good. For almost 19 years. Yeah, a long time. 15 years was at the South County office, go South County, with the DCFS as emergency response social worker, supervisor, and assistant regional administrator. I did not think I would ever leave that job. Until I heard that I get to be gay at work all day. No, they created an LGBTQ plus program. Of course they came to me. So I was like, I get to be who I am at work, y'all, and I get to impact some of our most marginalized populations, and I get to talk about intersectionality and the experiences of being Black and trans, and be educated on all of those areas. So I'm super excited that for the last 3 years I've been the LGBTQ plus program manager at the Office of Equity. And this is kind of an interesting moment for me, y'all, because I have my partner here of 15 years. Yes, Jonathan. And he is sitting next to my new boss. I do not know how I feel about this. The new Office of Equity Division Chief, Arena Turner, thought they'd be able to come in under the radar. They're sitting right next to each other. So I'm a little bit nervous for that, but that's okay.
All right. Well, that's a hard act to follow. So hi, everybody. Very, very honored to be here with all of you. So my name is Katherine Gardner. My pronouns are they and them. And I am a physician at LA County Department of Health Services. I am relatively new to LA County. I've been working in my current role for almost 2 years now. And when we came together to create this presentation, Jamie said, okay, well, so y'all, how about you introduce yourself with how long you have been serving the county? And I will tell you all that I said, Jamie, I will not do that because I have not been serving the county, I've been serving my community. And that is the attitude that I'm really hoping that this new wave that you all are part of is going to bring to our services, is going to bring to our county, is going to bring to us, because we desperately have needed this for a long time. I am thrilled to be sharing the stage with the two of you, and I am thrilled to be sharing the stage with you. And so thank you all for having us. Really excited to be here.
Another tough act to follow. Also very grateful that I was not facing that music video as it was playing, because I would not be prepared to speak at all. So my name is Rebecca Gitlin. My pronouns are she, her, hers. I am a clinical psychologist by training, and I work within DMH's Anti-Racism, Diversity, and Inclusion Division, where I serve as the LGBTQ plus clinical services specialist for the Department of Mental Health. So like Katherine and Jamie, I have been doing my current job for not too long. I started my position March 2nd of 2020, which was quite the time to start a new job. And not only a new job for myself, but a position that had never before existed in the Department of Mental Health. So I entered the department almost 2 years before that. My background is in behavioral medicine, lots of experience with LGBTQ plus mental health, as well as perinatal and postpartum initiatives. And I had actually come from the veterans mental health sector when I came back to DMH, and observed, as I imagine many people here have observed about DMH, at least historically, and maybe all three of our departments, gee, this is the public sector. We are designed to serve the most marginalized, the most under-resourced and underserved communities, and yet I am not seeing anything here that is specific to diverse genders and sexualities. And I feel incredibly fortunate to have been given the opportunity to start the process of kind of catching DMH up to the present day. And I'm sure many of you know this through your own experience. Systems change is really hard. Culture change is really hard. And so even though we've all been at this for 2 to 3 years, it feels like we're just at the beginning of a fulfilling and very challenging journey. So we're also grateful to be here and sharing this space with all of you and letting you know where we're coming from, which many of you, for better or for worse, know already, where we're at and where we're hoping to go in the future. So thanks for being here with us.
Before we start our presentation, I just want to point out that you did hear during our introductions Dr. Gardner and Dr. Gitlin. I do want you all to know that Neil Patrick Harris played a doctor, and so I am not Dr. Estrada, but I'm almost there.
I think so.
Yeah. And Dr. Gardner will go ahead and do some word clouds for us.
Okay, so I'm going to stand up because this is going to require a little bit of energy on y'all's part. So I'm going to put in the energy by standing up, and it'll help me too. So, dun-dun-dun-dun, next slide, please. Here we go. All right, be brave, and we're all ready for this up here. So please use this QR code if you can to type in some words that describe how transgender, non-binary, gender diverse, gender expansive, intersex people feel when navigating county systems.
Yeah.
But for myself, so thank you all. So scared, lost, frustrated, confusing, alone, invisible, uncomfortable, discriminated, overwhelmed, challenged, oppressed, confused, forgotten. These are all true. These are all realities, and this is the sort of the setting in which we work, in setting in which we provide services as a county, and a one in which.
I'm sorry. I know we have county people in here, y'all. I want this to sit with you. This is how our trans, gender non-conforming, non-binary, intersex, this is how people feel as they come to us for help. I know that I didn't join this profession for people to come to me like this. I want that to sit in with y'all.
Mm-hmm. Thank you. So I'm going to take another look at this for a second, and then what I'm going to challenge us all with the next slide is actually to step into some imagined future. And let's go on to the next slide. Let's share what we would want from county, what we hope to see from county, what we should see, what we demand to see. What is our right to see? So hope, support, seen, safe, acceptance, love, guidance, easier navigation, welcome, streamlined process, tailored services, respect, understanding, representation. So I would suspect that now it isn't surprising to any of you that the three of us, and I imagine all the county workers that are out here, actually would create this same exact word cloud. So these words are the words that we are going towards with our work as well. We know we're not there. And our presentation that we're gonna now continue forward with all of you, is really to talk about this space that we're currently in, moving between the last slide and the word cloud we came up with about where we are currently, and this slide, because this is where we're going. Again, it's our right to be here. It's our right to demand this. It's our right to hope for this.
You can go to the next slide, please.
All right. So I know today's conference is called More Than Sexuality or Gender, but we're going to talk a little bit about sexuality and gender. So for those of you who may not be familiar, I'm actually surprised by how little I've heard the acronym SOGI stated today. Usually I hear it 74 times a day. But SOGI is an acronym that stands for Sexual Orientation, Gender Identity, and Gender Expression. And I'm not going to go through all the stats on this slide. They speak for themselves. You're welcome to read them, and I'm sure you have been exposed to them multiple times in different ways throughout the day already. But essentially, why is it important for us to really know who the people are that we're serving? I'm sure we can all intuitively answer that for ourselves. But what we know is that LGBTQ+ young people face really significant disparities and inequities when it comes to mental health outcomes more generally, and social determinants of health as well. And one of the ways that we understand how that comes to be, how that's perpetuated, is through routine experiences of hostility, discrimination, rejection, and invisibility. So much of what we saw on this last slide about what we hope to see had to do with being seen, being supported, being accepted. And that really starts with knowing who it is that we are serving in their full, authentic selves. We know that one of the ways to address these disparities is to promote seeing each other, knowing each other, and setting up affirming and safe places and relationships through which we can receive care, particularly when we are at our most vulnerable times in our lives, which often is when folks are coming into our system of care in the public safety net. Next slide, please. And so we can think about this on an individual level, and we can think about this on a systemic and institutional level. But for many of us, we're working with young people as well as their families, whether they're families of origin, chosen families, resource families, etc. And so this is additional data that I think is really important for us to keep in mind. So this comes from the Family Acceptance Project, which, if you're not familiar with the Family Acceptance Project, I highly encourage you to look them up as soon as you get home. It is free to access all of the amazing research and resources that they have. What they looked at was the differences in health-related outcomes between LGBTQ+ young people who grew up in households that were affirming and supportive of who they are, and LGBTQ+ young people who grew up in households that were rejecting or hostile. And of course, it's all on a spectrum, right? And what they found was that young people who grew up in rejecting or hostile household environments showed, and this probably won't surprise anyone here, showed really high levels of negative health-related outcomes, leading up to and including suicidality, suicidal ideation, attempts, and behavior. What isn't on these slides, but what I will also just plant the seed with, and we'll get to what this looks like systemically a little later on, is what they showed for young people who grew up in households that were affirming, supportive, and accepting. Not only didn't show these negative health outcomes, but actually showed great gains in positive health outcomes that we really aspire toward in the work that we do. Higher levels of self-esteem, greater quality of relationships both within the family and outside of it, and the belief that one can be a healthy and happy adult with an LGBTQ plus identity, or LGBTQ plus identities plural, which is huge for the young people that we work with. So I want all of us to keep these statistics and these research findings in mind as we think about what systems change can and should look like for our young people.
You can go ahead to the next slide, please. So in terms of the research, and Rebecca had mentioned data, that has been a barrier when we're talking about our county systems. So data relative to people who identify as LGBTQ+, because we just have not captured it. And what I'm saying by we have not captured it is we're not asking people about their sexual orientation and gender identity. And the importance in doing that is several things. But I mean, we can look at learning from it in terms of what their health disparity outcomes are, or if they've improved. From a county perspective, there's also funding. If we can say how many people are using certain services, then we can kind of fund those services more. And we've been not able to do that. So when we look at the research, we're looking back to 2014 when the LA LGBT Center, UCLA, did a study specific to LA County foster youth. Y'all are like, that's 2014. That's 9 years ago. We know. It's the only data we have specific to LA County foster youth. But what they found was that from 12 to 21, they are overrepresented, which is what we refer to as disproportionality, in the foster care system. So almost 19% of foster youth, 12 to 21 years old, identify, as LGBTQ+. And so we know that that's a little bit outdated, so we're gonna say it's on the lower end, and we're gonna say that because we've looked at some comparable studies that have been done around the country, and they have found upwards of 30, 32, 30, let me see, y'all. 34, I didn't want to have to do 34% in New York City and 32% in Cuyahoga City. So we're going to say that the 19% is on the lower end. And in terms of the disproportionality, when you look at the data around how they identify across the US, 9.5%. So even if we wanted to use the low end, our youth, our LGBTQ+ youth, are overrepresented double the amount of youth how they identify across the nation. And we've been able to make some grounds there, but we wanted to be very transparent with y'all. And that's one of the areas in which I think our county systems are attempting to improve, which is saying, how are we talking to people? And this goes even beyond sexual orientation and gender identity. How are we talking to people about ethnicity, race? How are we learning who these people are that we're working with, that we're supposed to be helping? And so we did want to bring a little bit of the research. We brought some of the outcomes that we've been tackling, we've been looking at, but we also want to bring some personal stories to you all. So when we go to the next slide, we want to introduce you to Jordan. And in all transparency, Jordan does not exist, but their story is real. I don't have to tell that to y'all because you've heard it today. So while we did not get consent from an actual person to share their story, we've brought you stories that each of us have heard and each of you have heard because it's been told today. Jordan uses they, them pronouns, and recently Jordan went to school and was called into the office because Jordan has not been attending school. And through that conversation with the school, a call was made to the child abuse hotline, 1-800-540-4000, and it was explained to the hotline that Jordan's family kicked them out because of their gender identity. And Jordan has been living on the streets, and their needs have not been met. Physical needs, emotional, mental health needs have not been met. And so a call was made to the child abuse hotline, and after an investigation, Jordan was now part of the child welfare system. And you can go to the next slide, please. So we want to talk a little bit about, but first we want to say historically, and I'm going to go back to pre-2018. Before 2018, we didn't do a great job of talking with people about their sexual orientation and gender identity. I can't give you exactly what would happen because it would kind of just depend on which office you were working with, who was your social worker. There were probably no, what we did for the Department of Children and Family Services, we said, yes, y'all, we have some community partners we could refer you to. As you know, Penny Lane has been doing this conference for 13 years. They have been providing services to people who identify as LGBTQ+. And so we would refer our youth who identify to Penny Lane. We'd refer them to the Embracing Identities program, to the LA LGBT Center, and then we'd be like, that's where you need to go. So historically, we haven't done too great. In 2018, there was with some advocacy from the Board of Supervisors, there was a new board motion with some directives in there, which caused our departments to come together with a few other departments, Department of Probation, Public Health, and they really started having some conversations around services, around how we're meeting needs of youth who identify as LGBTQ+. And so, as Rebecca said, we created, so back then we did not have an Office of Equity at the Department of Children and Family Services. We did not have an LGBTQ+ program. We did have some LGBTQ+ champs, but again, that was just kind of dependent on your office. I know the South County office where I was, we had some LGBTQ+ champs, but the work maybe looked a little bit different than it does today. And so I want to bring you fast forward to today, and I do want to say, this is not everyone's experience. We're going to give you some examples of services that are available, of things that we're trying to do, but that doesn't say that we're not hitting the mark sometimes. It also means maybe we're doing great work sometimes. We've heard some examples of that. So I'm going to tell you about kind of what's available through the department today and what Jordan may experience, but just know that it's not everyone's experience with the Department of Children and Family Services. I will just call it DCFS from here moving forward. So Jordan gets assigned a social worker, and hopefully, we know all of our social workers have taken the RISE training from the LA LGBT Center, Recognize, Intervene, Support, and Empower. So the social worker does have some foundational knowledge around sexual orientation and gender identity, and is able to start having that conversation. Whether or not they can have it in a way that is affirming is something that we are working on. But what we do know is that our regional offices have LGBTQ+ champions in each of the offices. So if the social worker needs some support, they can absolutely go to their champion and say, I need some support, and what can I do? And so thankfully, Jordan had a social worker that knew they could utilize their LGBTQ+ champion. And if you can go back a screen. And so Jordan, also we needed to look for a resource home, and resource home is like the updated terminology for what we call foster parents, y'all. So we needed to look for resource homes, and that is sometimes very difficult. As has been said throughout this presentation, there's legislation going on around this nation, anti-trans all over the place, and while California is more on the progressive side, we still see discrimination and bias even within our own department. Our own workforce, resource parents, we are connected to faith-based organizations, we see it there. So we are not absent from experiencing that. And so thankfully, we have been able to work with our BIS system and say, we need to know do we expect all resource parents to be affirming? Yes, that's the expectation. That's from me. To see it play out, we're still working on. Yes, but I can tell you that they're not all affirming, but we need affirming homes right now. So it's not like I can say, hey, every single resource home, we need you to be affirming right now. Because one, that's not going to send a great message. Not that we need to send a great message, but I know we don't need all these resource homes to drop out. We need homes for people. What I need to know right now is which of you can affirm youth who are LGBTQ+, because I have youth right now to be with someone who can accept and affirm them, connect them to services. We saw a great example of what that looked like from Cynthia at the end there. Who does that for our foster youth, by the way? Who affirms them in the way that you did for your youth? for your children? Is it our social workers? Is it the resource parents? Whose responsibility does that fall to? Super tangent, but I saw you and I wanted to appreciate you for that. So we do have a list of resource homes in which people have said we are ready, we're educated, we're aware, and we want LGBTQ youth to be placed with us. So we are able to reach out. I could talk about this forever because we have what sometimes people refer to as group homes, which we now call short-term therapeutic residential placements. We can go on for these forever, but we're going to focus on resource homes right now, y'all. So we are working on that. So thankfully, we're able to use this list. Social workers can call resource homes, and they say, we have someone who identifies as trans, and would this be a good match? And so that is something that we've been working on at the department. And then also, and I'm super excited because Penny Lane is one of our partners, but we have a formal pathway to support services for youth who identify as LGBTQ+. This is huge. As someone who is part of the community, when I first became the LGBTQ+ program manager, I went into a few meetings, and it was new to me, but it was not new to our community partners, and it was not new to clients. And I got an earful, put your money where your mouth is. You say you want all these things for youth who identify as who are LGBTQ+, but all you do is refer them to the community partners, and then what? And so now we actually have 4 contracts with 4 different community partners, and so youth who identify as LGBTQ+, of course, we're working on the practice around that. I can say in 2020, when we looked at our data, we had less than 100 youth who identify as LGBTQ+. Less than 100. We're working with 20,000 youth at any given time at the Department of Children and Family Services. So if you wanted to do the 20%, it's a lot more than less than 100, y'all. So we weren't doing good. And we still have a lot of room to grow. We have about 450 youth who now identify, who are LGBTQ+, and more than half of them have been referred to the supportive services, which we call LGBTQ+ tailored services. So youth who are LGBTQ+, we can say, hey, Penny Lane, Embracing Identities, hi, Summer. We can say, hello, LA LGBT Center. We can say, hello, Long Beach LGBTQ Center. We can say, hello, Help Group Kaleidoscope Program. And then we refer youth to them, and then we can follow up and say, how is it going? And it's tailored, right? So we're not saying, hey, all youth need to go and sit down with a therapist. All youth need to go and da-da-da-da. We're saying, hey, you all are the experts in the work. The counties have a lot of work to do, but y'all have been doing it for, I'm pointing at you, Summer, y'all have been doing it for a long time, 15, 20 years. So we're saying, work with our youth, and we're gonna learn from you, and we're gonna be partners with you, and we wanna continue to know how we can improve that program. And so thankfully, as part of where the county is at now for DCFS, we've made some big strides. I hope you can hear that. I hope you can also hear that we've got a lot of work to do. But Jordan also is now all youth who work alongside the Department of Children and Family Services, they get referred for a health and medical exam through the Department of Health Services, and so Jordan gets referred there, which is where we're able to submit the referral, and I now know that Dr. Gardner is available, like my counterpart at DHS, and so if I needed to, I could reach out to Katherine. But at a minimum, we're going to submit a referral and say, Jordan, we'd like for you to be seen at the Department of Health Services.
Perfect. And I'll take it here from, again, I'm Katherine Gardner from Department of Health Services at LA County. What we do is medical care, so medical services within our department. And I'm going to ask you to go ahead and advance it to the next slide. I'm going to talk a little bit specifically about the space in the program that I work in. So I'm one of the leads at the new, very new, gender health program at LA County Department of Health Services. This is a program which started almost 2 years ago. So we are almost 2 years old. It is been something that we have been growing. We've got 2 clinical sites. And one of those clinical sites has been around for a little while and is the main site in which we see our youth that are involved in DCFS one way or another. There's a lot of work that we do, and I feel really lucky in the position that I have because I kind of wear two different hats. I both am, as a physician, I see patients in an exam room one-on-one, and we go through a whole lot. And then I also wear this programmatic hat where I can build this programming. I can say, look what happened. Like, let me tell you the story of what's happening here and how this needs to be different, how this is successful, how this is in process. So what do we do in my clinical space? So we see people of all ages. So while we're talking about youth and focusing specifically on youth involved in DCFS within this presentation, in my clinical space we see people of all ages. Youth involved in DCFS certainly are a good chunk of those who we see. We do a lot of talking, a lot. Most of our visits involve a lot of talking and exploration of gender, experiences of gender, hopes, dreams, wants, fears around everything. We also do puberty suppression, hormones, coordination of care for specialty services like surgical interventions, dermatology, mental health, and then community support and resources like name, gender marker change. There's a lot that we do in our clinic. Again, like Jamie said, holy moly, this sounds amazing, right? And I wish sometimes it is. We need it to always be amazing because sometimes it's not. So if we take Jordan and we say, okay, so here is Jordan. Jordan has now been referred to medical care at LA County Department of Health Services. And LA County Department of Health Services has identified that a referral into one of my clinical spaces is important. What Jordan could expect to experience would be a lot of coordination actually for Jordan beyond the talking. So that's absolutely something that Jordan could expect. But a lot of coordination. And that's one of the unique things that at least within our clinical space that I think we're able to provide. And I'm gonna go on to the next slide because there is some real special knowledge, and this doesn't involve medical care, so this is definitely not stuff I've learned in medical school. I learned it through working with Jamie and with Rebecca over here, but how to navigate the system. So youth in the foster system have the right to access hormonal, gender-affirming medical interventions, if it's appropriate for them. And there is a whole lot of stuff that has to go into that, a whole lot. And that's where we jump in. And that could be, again, coordinating, navigating that, coordinating and navigating the legal process behind getting court orders, behind getting parental consent, what's included in parental consent. Holy moly, it's a lot. And it is wonderful and so needed. And again, while all of this sounds amazing, right? I get excited talking about it. This is amazing. It is amazing, and it can be amazing, and we know that we're not doing it consistently enough because sometimes it still is not amazing for people. Actually, many times it still is not. So how can we standardize this? Because this is a lot of individual work. This is a lot of me calling people. This is a lot of me calling social workers, calling lawyers, and that is wonderful and important and needed, and we need it not just for one person or two people. We need it for a lot of people. So how can we make this part of our standard work? We're starting to understand these systems, how we work together. That's critical. And working together is critical because of this. But how can we make this part of our standard work rather than just, hey, I'm passionate about this, I care about this as an individual. That's great, wonderful, good. But that's not enough. That is absolutely not enough. Our whole system needs to get behind this, and that's where we're going. So beyond, in terms of thinking about youth, beyond the sort of specialized knowledge that we have, or we are building, I should say, around navigating our systems, which is, again, somewhat obscure even for those of us on the inside. We also have some special knowledge around navigating youth that are involved in the juvenile justice system here in Los Angeles. So we are the specialty care providers for youth in juvenile hall. And again, navigating and ensuring that those youth have access to the services that they desperately need and deserve is very important. And again, requires a lot of, while this is medical care, not the kind of knowledge that you learn in medical school. And those are the processes that we're building, the knowledge that we're building, and not just knowledge as individuals, but knowledge as a collective system, to be able to truly and appropriately provide meaningful services. So that's a little bit about the work happening at LA County Department of Health Services.
Great. Next slide, please. And actually, if we could click just 2 more times, the animations are a little funky on this one. There you go, great. So Katherine and Jamie both have talked about coordination and navigation a lot, and I think that is inherent to interacting with multiple county departments, which so many of our systems impacted youth do. Is that me? Okay, better. And that's exhausting, right? That's exhausting for us, and it's certainly exhausting for young people who are having a hard time and need help. And one of the things that I really wanted to see happen in DMH is to ease that experience of coordination and navigation as much as possible. Jamie mentioned that there is an expectation that all resource families are affirming, and yet we know that we need to really elevate and uplift the resource families that are already there. I think the same can be said about mental health practitioners, right? The expectation from the Anti-Racism, Diversity, and Inclusion Division is that everyone who works for our department is anti-racist, gender affirming, LGBTQ+ affirming. We know that that's going to take some time to get there. And so a lot of what the work that we've done centers around is creating community for folks who are already there. I think the 3 of us for sure have had experiences of feeling like we're on a lonely queer island within our respective departments, and so building community with each other. And I very quickly saw that there were many people throughout the Department of Mental Health who felt similarly within their respective programs. So how can we build professional community so we can learn with and from each other, and then also promote the community that we're establishing to the communities that aren't actually working for LA County, the communities that we serve. And so someone like Jordan, who may have first come into contact with DCFS, then referred to the gender health program, what is very likely to happen now is that I might get an email from Katherine saying, hey, Rebecca, we have a new patient who is in need of a referral letter for gender affirming treatment. This was one of the first things that we were able to accomplish in the Department of Mental Health, which we're super proud of. So many of you may already be aware that for trans and gender diverse people of all ages who seek gender affirming medical care, now primarily surgeries and not hormone therapy, but surgeries and beyond, they need to get a psychosocial assessment and a referral letter or a support letter from a mental health practitioner. I could give a whole other talk about how I feel about that setup, but that is how the system is right now. And it can be really, really hard to find a mental health practitioner who can do that assessment and write that letter in a way that is affirming and supportive and really in the best interest of the client and their own authentic self. And so one of the things we've been able to establish is, and this is the bottom left bullet point, is a community of gender affirming treatment advocates within the Department of Mental Health. So I would get an email from Katherine. Katherine might say, we have a patient who needs a letter, and we now have a community, a cohort of DMH clinicians who are located all over LA County and work with all age groups and speak many languages other than English, who are able to provide these psychosocial assessments and support or referral letters from a gender affirming and informed consent model. So really kind of trusting the client in telling us who they are and what they need, not feeling like there's something that we need to evaluate or confirm about them, just kind of believing someone when they tell you who they are and what will make their life better. And also doing this within the realm of what will allow that care to get covered by Medi-Cal, so they don't have to pay for any of it. So that was kind of the first initiative that we were able to get going within the Department of Mental Health. And then, whether or not Jordan or anybody else would need a letter or desires gender-affirming medical care, Jordan may also benefit from some mental health services. And so again, finding a practitioner within our department, the largest public mental health department in the country, finding a practitioner who you could know would ask you who you are respectfully, document that in a respectful way, and then provide you services that really take all of your intersecting social identities and honor all of them and integrate that within your treatment has been very hard for many people, not just LGBTQ plus folks, but certainly for LGBTQ plus folks. So that is where our DMH LGBTQ IA2S Champion Network comes in. So this is a growing network within the Department of Mental Health that includes, you could see all the positions on the right-hand side, includes mental health practitioners in administrative and clinical capacities, as well as allied professionals, psychiatrists, administrative support services, et cetera. And so these are folks in our department who have made it known within the department and outside of it that we are committed to serving our communities, that we are passionate about learning with and from each other, and that we really want to cultivate a safe and brave space within a department that has historically been anything from like a black hole to not a safe place to receive services, to sometimes one that has been outright traumatizing for folks. So we're really trying to implement this across the board by training all of our providers, but then creating a specialized network as well of folks who can be affirming. So we'll go to the next slide. There's hope. So you heard me a little bit earlier talk about the importance of affirming and supportive relationships and environments, and we're also working together to work toward an affirming and supportive county system, right? Again, thinking about coordination and navigation and how totally exhausting and sometimes traumatizing that experience can be, that a lot of the work that we're doing in collaboration with each other is really trying to mitigate the negative impacts of that.
So moving forward, and I know that Rebecca just touched on this a little bit, there's a lot of work to be done, y'all, but we wanted to elevate some consideration, and we also want to leave some time for questions if you all have any. But in terms of moving forward, yes, county departments, we want to reach out to all of them. We want Parks and Rec, we want probation, we want everyone to come together and say, how are we doing and how can we do better? But we also realize that there's some partners in this work that we need to be part of it as well, and you'll see community is at the top of that. And so who are we talking about when we're talking about community? We're talking about stakeholders, young people with lived experiences, to have a chair at the table in decision making, building, envisioning, and of course our community-based organizations like Penny Lane that have been doing the work for years, y'all. We have so much to learn from you all. So, nothing, what is the saying? Nothing about us without us, nothing with the community without the community. And so it's very important that we raise that, and that's one of the areas that I think we'd like to ensure we are doing better as we move forward.
And you may or may not be aware that within LA County departments, much of our work is driven by and elevated by the LA County Board of Supervisors. And so I just want to name that we are incredibly fortunate to have an LA County Board of Supervisors who is meaningfully invested in this work, really wants to see LA County do better by transgender, diverse, and intersex community members, and really wants to support us in the work that we're all doing and with our county and community partners as well.
And the last piece here is really a question of, again, bringing all of this into alignment so that we have a wave, we have strength, we have a voice that can't be heard, or can't not be heard, that we have community, that we have our leadership within government, and that we have us on the ground within as well. That these lines become blurry, that we are all aligned with what we are wanting and what we're pushing for. So one of our newest and thing that I'm excited about on a personal level is that we've been building what we're calling the Gender Health Coalition within LA County. This is something for LA County employees to come together, to collect ourselves, to collect our voices, to be that push, so that me over in my sphere can help Jamie in his sphere, can help Rebecca in her sphere, that they can help mine as well.
We want to say thank you for making the space for us. We hope you learned something today, but we also want a few minutes for questions, y'all. So you've got DMH, DHS, DCFS. Bring it. Be kind, but bring it. Like, or not. Don't be kind. Like, we're here for that. So does anyone have any questions? Yes.
Additionally, everybody, let's give it a round of applause for LA County panelists. Thank you so much. If everyone please can, if you have any additional questions, please reach out to them. They're going to be here for a little bit longer. Please.